that there is something called the social determinants of mental health, these societal and external forces that are leading to these poor outcomes that we're seeing that have really nothing to do with neurobiology and nothing to do with brain chemistry, but really have everything to do with what are the environmental factors that are contributing, or what's the context that's being set further upstream from the risk factor. So these things like adverse childhood experiences and mass incarceration and unemployment and underemployment, and I could go on and on and on. These social determinants of mental health were setting the context for the development of the risk factor, which then led to poor mental health outcomes and mental health inequities between certain populations. I also came to understand that if you're intervening at the level of the social determinants, you are still intervening too late because there is actually context that happens even further upstream that is setting the stage for the development of the social determinants of mental health. But under all of that, what's driving these structural determinants, what's driving all the way upstream are two very fundamental issues. Social norms, or the beliefs we have in society about who in our society is worthy of value and who is less worthy of such value. And then based on those decisions about who is deserving and who is less deserving, what are the public policies or the laws that we pass that reflect those belief systems? Because those laws that we pass then create unfair and unjust distribution of opportunity, which set into motion the social determinants of mental health, which then leads to the risk factor, which then leads to the poor outcomes. So then the work becomes, how do we intervene at the level of our social norms and our public policies?